Hello everybody and welcome to the Thursday edition of Video Clips. According to a new study, poor diet and high blood pressure are the two biggest contributors to premature deaths worldwide. The data were drawn from the Global Burden of Disease Project, which includes 188 countries. It's been going on for 25 years. Now, according to this report, the risk factors for early death have changed since 1990, which at that time, child and maternal malnutrition, contaminated water, sanitation, and lack of hand washing were the biggest risk factors for early death. So it hasn't been all that long ago, and look at the shift. These types of problems have been replaced with high blood pressure and worsening diets. So the researchers identified 79 risk factors for early death in total, 14 of which were dietary factors. And this will not shock you. They included low intake of fruit, vegetables, nuts, seeds, and whole grains, and high intake of sugary beverages and red meat. For women living in high-income countries, having a high body mass index was the leading risk factor. Of course, that's all diet-related. For men, high blood pressure and tobacco were the leading risk factors. And in Russia, alcohol intake was a second leading risk factor. So what we've done is we've replaced the diseases associated with poverty with diseases associated with increasing affluence, which almost always brings on some version of the Western diet. The authors reported that all the risk factors included in their analysis were modifiable. That's the good news, which means that there is potential for improvement. I mean, this would be terrible if the cause of death was things falling out of the sky. We can't change that necessarily, but this is diet and lifestyle. So, as is usually the case in these types of reports, they called on policymakers to come up with and implement plans for solving this problem. Now, I don't have a lot of confidence in that. And I'll tell you why. I've spoken for years about the United States Department of Agriculture and their dual role in terms of being an advocacy organization for farmers and then working on issuing dietary guidelines for Americans, and they really can't reconcile those things. But I've looked at the dietary recommendations from USDA-type government agencies in many of the countries that were included in this particular analysis. And there are some that are better than others, but there aren't any. I have not yet seen a dietary pattern from another country that actually leads to optimal health. There just seems to be the universal problems of reverence for protein, emphasis on animal foods, and a really unwillingness to step on the toes of industry. But it doesn't mean the problem isn't solvable. It means we just have to do it differently, which is the way we're going about it. Grassroots, educate the folks, get people to make different decisions. It's a lot harder, but we can bypass government and entrenched medical and agricultural institutions, go straight to the people, tell the story, and make a difference. And we are making a difference. So I always periodically put this out there. If you want to join us and help us make a difference, we have lots of opportunities for people to join Wellness Forum Health and help us educate others. So send me an email at pampopper@msn.com if you'd like to do something about this mess. All right? Okay, I started looking into this, what I'm going to talk about here today, because it's so common now. And it's this issue of thyroid nodules, which more and more people are finding out that they have. Now, what is a thyroid nodule? Well, it's a little lump that develops on the thyroid gland, and if it's toward the outer edge, it actually can be palpable, but most of the time, people don't know that they have thyroid nodules. However, I'm almost 59 years old. By this age, half of us have thyroid nodules. By age 60, the incidence is 60%, 70%. So the longer you live, the more likely you are to have thyroid nodules, and they are not likely to cause you any problems. But an increasing number of people who have no signs or symptoms of thyroid disease are finding out that they have these nodules. Now, the discoveries are made several ways. First of all, a growing number of endocrinologists are actually examining patients to find palpable nodules. And I'll get to why that is. I mean, we find out something's going on, we got to find more of it, usually is the way medicine works. Now, about 20% of us have nodules that are palpable if you're examined properly. About 2/3 of us have nodules that aren't palpable but can be detected by some type of imaging. So how does this imaging happen? Well, people who are told to get scans or MRIs for something else find out that on the image there are thyroid nodules. Gilbert Welch calls it an incidentaloma. You wouldn't have known about it if you hadn't been getting an image for something else, and then you find out you have these thyroid nodules. And then doctors are screening to find the thyroid nodules because so many people have them, and they just can't help this. This is a great opportunity, a new disease to be discovered and treated and all that kind of stuff. So this accounts for the fact there's a 4-fold increase in the last 10 years in the number of ultrasounds in the neck, which has resulted in more discoveries of the nodules and more diagnostic tests, including needle biopsies. So if you scan people who are my age, most of the time you're going to find nodules. All right, so why are we doing all these biopsies? Well, patients are told that these nodules can develop into cancer, so just to be sure, let's biopsy them. And then if they're declared benign, sometimes people are told to have surgery. If they're declared benign, then the American Thyroid Association recommends that individuals with benign nodules should have repeat ultrasounds at 6 months and 18 months and every 3 to 5 years, unless the nodule grows by about 2 millimeters, and then we should do something about it. Now, there's very little evidence to support this idea that a 2 millimeter growth in the thyroid nodule is something to be concerned about, and fortunately a large prospective study provides some insight into the actual risk that a nodule is going to become cancerous. All right, so researchers looked at and performed annual ultrasound exams on 992 patients who had between 1 and 4 asymptomatic nodules, and after 5 years of follow-up, only 15.4% of patients had experienced any nodule growth, according to the ATA's definition. The average growth was actually bigger, 4.9 millimeters, but only 9.3% of patients developed new nodules, and only 1 nodule was cancerous out of the whole mess, all right? So the researchers suggested that perhaps we should revise the recommendations on ultrasound. But I want to address, before I come back to some conclusions about this, there's an issue about this early detection of thyroid cancer. So this study says we need to stop worrying about this stuff, all right? Increases in examinations, imaging, biopsies have resulted in more and more people being told they have thyroid cancer. And of course, this early detection thing is always part of the story. If we find it early and we treat it, then you're not going to die of thyroid cancer. Well, we have an explosion of diagnoses. Right now, 37,000 people a year in the United States are being diagnosed with thyroid cancer, but this incredibly interesting thing has happened, which is 0 decline in the death rate. We still have 1,600 people a year dying of thyroid cancer, which means that many of the people who we're treating don't have thyroid cancer, they've been overdiagnosed, they've been overtreated. And so it goes back to early detection of thyroid cancer, which really identifies incidentalomas, which are not going to become clinically significant. And by the way, interesting research study in Finland shows that we all have thyroid cancer. This research group took people in a hospital environment who died of something not thyroid cancer, and they autopsied them. They took apart their thyroid glands, and they found that after they sliced it a certain number of times, there was thyroid cancer in all of those thyroids. So, and they reported that, this study group reported that the smallest thyroid cancers are so common they should be considered normal. All right, so the U.S. Preventive Services Task Force recommended against screening for thyroid cancer several years ago, but it has not, of course, cooled the enthusiasm of those who screen, because scaring people about thyroid cancer has become incredibly profitable. Think about those 37,000 people who need to have all those ultrasounds all the time and get biopsied and then have surgeries. And you know, we've created, I don't think thyroid cancer is anywhere near breast and prostate cancer, but you know, it's a nice little profit center for enterprising doctors and medical institutions. So patients should decline screening for thyroid cancer and nodules, and they should be careful about other screening tests too. Most are not helpful, many are harmful, and the risk of finding something clinically insignificant but hard to ignore, like thyroid nodules, is high. For those who've been diagnosed with the nodules, almost all the time, these are incidentalomas that should be ignored. So I wrote this because it's an interesting topic, and also because we sure do have a lot of members that face this issue, and now we have a nice article posted in the Health Briefs online library to which we can refer them. All right, that's all for today. As usual, have a great rest of the week and weekend. Pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Tuesday with more news.